Buenos días. ¿Cómo amanecieron todos? Good, good. Well, I just want to thank everybody for the opportunity to be here. It's really just very special. I've known Marie for many, many years, and the work that you all have created here with familias is very, very impressive, and it's something that I hope that can evolve nationally, because we need more support for our Latino families, as people don't underestimate our growth, and we still don't see each other on decision-making policy boards where we can talk about the things and the issues that are very important to our community and to our families. So es un honor y un placer estar aquí con todos ustedes, y gracias por la invitación. Special thanks to Gail Brown-Miller as well, and Jamie Cleaver, and the planning committee. You all, again, should be just really very proud of what you've created here in Portland, and it's a pleasure to be here. I have a program that I'm going to be sharing with you in terms of how it got started, and I got started back in the early 90s. I had the pleasure of, when I completed my doctoral degree, to submit a grant and talk about issues that were important to my heart. And I come from San Antonio. I was born in Laredo, Texas, right on the border. And I saw a lot of things that were going on in our communities. And when I went to college, there weren't very many individuals that looked like me that were in college. But my parents always said, you know, la educación es algo que no te pueden quitar. You know, your education is something people can't take away from you. And they opened the doors. And I had brothers before me that went to college, but my parents had not had that particular opportunity. So today I'm going to I'm going to share with you a new institute that I was able to found in 2006. The president of the Health Science Center in San Antonio asked me to come back and join him. And he says, Amelie, I want a center that looks at, you know, health disparities. And I said, you know, Dr. Henrich, I'll be glad to do that. I said, but I really want you to know that I want to be known for promoting health and not looking at disparities. I said, because every time I go into my community, I got to tell them, you know what, diabetes is the highest, you know, cause of death here in our community, or cardiovascular disease, or cancer, or AIDS. I said, I'm always bringing bad news. I said, I want to bring good news to our community and show our community that they can do something to turn their health around. So with that, I'd like to just share a little bit about what I'm going to be talking about today. Tell you about my home base, who I'm very fortunate to have a lot of Latinos who are working with me, and non-Latinos who believe in my passion as well to make a difference. And then talk to you a little bit about how we've integrated science and theory into our work to try to make a difference in our communities, and talk about some specific networks that we build. One that, and I knew Carlos from many years ago as well, you know, when I first started my work in cancer, and now we're applying our work to childhood obesity. But first of all, who are we? We're now the Institute for Health Promotion Research, and we are focusing on, and we're based at the UT Health Science Center in San Antonio, and we really want to look at the unequal causes and issues that affect our community. We're responsible for 38 counties in South Texas, over 4 million people. 67% of our population is Latino. Many of them don't have access to health insurance and have lower education levels. So our job is to really help them connect with our communities to lead a better health. When I was in public health, people said, what's more important, your health or your education? And those are two big pillars that we cannot separate. When we try to encourage equity, we really need to look to make sure that we bring our communities up and they get as much education as they can, but they also have to be healthy to do that as well. So these things go hand in hand. One of the things that we focus on is a lot on behavioral communication. So our communities are very auditory, and they learn by seeing others do something positive. So we do a lot of behavioral research, but at the same time, you know, as mentioned earlier, I'm very passionate as well in terms of training. We need to get more of our individuals in higher education, and so we're trying to involve more Latinos in research. And we also have a program called Éxito, which we've been doing over the last 5 years, taking doctoral students or individuals who are interested in becoming doctoral students and convincing them that they can do it. Proud to say that we have one of our graduates from last week. Our program is the first week of June, and Beatriz from the LA area is here, and we're really excited. And I told her that this cohort that came through, we've had 80 participants come through, but this last quarter, the last 20, I told them they were really special, they really bonded, and they were really passionate about doing something different. And I said, I really want to see that 100% of them apply for a doctoral program. If you don't apply, you'll never know if you can make it. So, con ganas. Seguir adelante. So our institute is based on 90% research, so we have to bring in our dollars to stay alive and based on research efforts. And so we work, again, through NIH grants, nonprofit organizations, volunteer organizations to keep our work going. And in addition to doing our research and training, another important component is to make sure that we give back to the community and that we provide them with the information that they need to help protect themselves. So we always have these three elements in all the type of research that we do. And so over the years, I've been doing research since the early 90s. We've been building research networks. One of my first research networks was Redes en Acción, and I'll describe that a little later. But we've been in existence for over 20 years. And then from that, we recognized that there was a need to inform our communities about childhood obesity. So we formed another group that's called Salud America, and it's a Latino research program focusing on childhood obesity. And our networks have been growing. For example, our Cancer Research Network has done everything from increasing screening to now we're doing work in improving the quality of life as our survivors, as the number of cancer survivors continues to grow. So just a little thumbnail sketch of what we're involved in. I have a small army of about 35 individuals behind me, and I have to give them a lot of credit and work for all the work that's been done and the difference that we're trying to make in Texas. Now I'd like to transition a little bit to tell you a little bit about the science and the theory that goes behind our work to make a difference in our programming. And the first one some of you may have heard of is Dr. Albert Bandura. He's over the last 6 decades, he's a psychologist who really brought together some key elements that we try to inform and use to inform our program. His theory focused on how individuals acquire and maintain behavior and how they interact with physical and social environments. And then within his theories are some critical basic concepts. One of them is the self-efficacy. Self-efficacy is, how do we feel about making change? How confident are we about being able to change our behavior? And we learn that but through this positive reinforcement that we're talking about. For example, the pastor was just saying, hugs, just certain things to tell us, yes, we can do it. It's really important. That means self-efficacy. Another component is collective efficacy. How do we empower, for example, all of you to really make a difference in your community? It's this group effort that helps us overcome barriers and perform large-scale behavior change, changing policies in our communities. Can't be the voice of just one. And I love Margaret Mead's quote here when she said, "Never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it's the only thing that ever has." And that's why it's so important that we come together and work towards specific issues. Another aspect of the social learning theory was observational learning. Bandura, when he first started his research, did what they call the Bobo doll experiment. Kids were watching adults hit this Bobo doll with a plastic hammer and kind of, beating it up. And then when they allowed the children to go in and unsupervised, the children were doing the same thing that the adults were doing. They were hitting the Bobo doll. And if nobody told them, no, that's not what you're supposed to do, they kept beating the Bobo doll with this plastic hammer. But if somebody came into the room and said, reprimanded them for it or told them, no, that's not what you're supposed to do, then they stopped. So they call this observational learning, that we learn from what others do. And this is a critical aspect that's part of the work that we do. Another famous theorist is James Petruska. He developed what's called the trans-theoretical model, that people go through stages of change before they change a behavior. And you have two types of individuals. You have those that just have tremendous strong will. For example, if they have been smokers, they said, I'm going to quit tomorrow, and they can quit. There's other folks, such as myself, and trying to lose weight, you have to think about it, and then, so they call that the pre-contemplation stage. Then you have to kind of get ready for action and say, okay, how am I going to do that? And then say, okay, I can do this, I really want to change, and go into the action phase, and then we have to maintain that behavior. So there's these kinds of steps that loop around. People are constantly falling in and out of these different stages of change, but it's important for us to understand these concepts as we talk to individuals. So in our first program that we did that was called Salud, again developed in the early 90s, we developed something that was called the dual link model, which we brought all these theoretical frameworks together. We identified individuals from our communities that were doing positive things, who were quitting smoking or going to see the doctor, getting their mammography screening, and we took those role models and say, okay, where are they in the stages of change? What are they doing in terms of modeling for others? What kind of information can they share with our community? So we developed a term that we call behavioral journalism. We took them and placed their stories on the media, radio, television, and newspaper, so that we could reach the largest number of individuals. But then at the same time, we worked, as you do, with promotoras in the community, with community health workers, and we educated them on the specific subject matter, and then they in turn would hand out these, let's see, did I get it right? Where's the light? No? Anyway, these brochures that we hand out, they contained information about resources in the community, where they could get the information they need, who they could call to make an appointment. And it was our community health worker that was meeting in her community and telling people about this information. So the TV was our school, but the promotoras and the community health workers were the teachers providing the reinforcement, the positive reinforcement that we were looking for. And so every time we found a role model, this is a way that we don't have to force cultural efficiency and cultural efficacy, because it was naturally built into our stories. It was a real Latino telling their stories, their struggles, their barriers, how they overcame those barriers to come in for screening. So this facilitated observational learning for all of those who were watching the program. It increased self-efficacy, because they said, if that person is like me, is Latino or is Mexicano, and they were having the same issues that I have, and look at them, they did it. So it increased their efficacy, and it also showed them how they could overcome barriers. So we always put our stories together around with the real role model from the community, along with a physician that confirmed what the role model was doing. And we did that because in our community, Latinos put a lot of credence in what the doctor tells them, but how often do they go see the doctor? You know, once in a blue moon. But they feel the doctor is the most credible source of information. So by putting all of these elements together, we were able to make a difference. And again, the community health worker was providing the reinforcement for the individual that they interacted with to encourage that particular behavior change. So this is how the communications would go about. And the reinforcement is really critical. We, again, worked and trained with our community workers. They would come in for training sessions. We said, okay, we then send them off with these brochures, the times and dates where our programs were going to be aired on television, the radio, or newspaper. And they would then go out and give this information to our community. But they were also very critical in finding those important role models for us, because we wanted to make sure if somebody said they quit smoking, that they really did quit smoking. Because you can imagine what it would be like to say, oh, pues esa persona, Mr. Ortiz, dijo que dejó de fumar, pero yo lo vi el otro día, está fumando. You know, so we had to make sure that the stories were credible, and the only ones who knew that eran las personas de la comunidad. They could tell us, did this person really do this? So it was really important for us to bring all of those elements together. And through the brochure, we were providing cues for action. So in one of our first studies that we did, it was along the border, and we were encouraging women to come in for screening. So we used our mass media and our promotora network to get the information out. And this is an example of one of our stories. For example, Mrs. Valdez said, once I thought doing self-exams was enough to protect myself from breast cancer. I learned that mammograms can find breast cancer early enough to save my life, and I want to be here for my daughter. So again, these are real statements from the community that we were able to pull together and show how Mrs. Valdez went in and got her screening done. And then we also partnered very closely with one of our Latina reporters from Univision station. Her name was Monica Navarro, and she really believed in what we were doing. So she became the wraparound. We as my team would go out and actually find the role models, videotape the role models, we developed the stories, and then we worked with the news reporter to give the wraparound for the stories so that it all came together and we were on the news. And this is why we called it behavioral journalism, because it brought all those elements of journalism together. And every story focused on the peer role model sense of efficacy. In addition, as we were saying, we need 12 hugs a day. Well, we felt that you needed at least to hear our message 3 times a month before someone would really contemplate going in and actually trying to do something about their behavior. So we made sure that our stories were in the newspaper, that they were actually reading about it, that they saw it on television, or that they heard about it on radio, to make sure that all of these kind of things came together. And on this slide here, you can see each of our promotores had a specific area of the community that they were supposed to cover. We wanted to make sure that they felt safe in the communities they were going to, so they got to know their neighborhoods. We asked them to canvass their neighborhood and say, let us know if there's any churches or small grocery stores or small businesses or banks in your community, schools that you should know about, and that those should become your areas of distribution of where you go about leaving your information. And so they become very, very comfortable. And once I was at a meeting with many doctors, and they were, and it was to me a testament that our program was making a difference. He says, you know, when I asked my patient, well, what brought you in? Why did you come in? He says, because of Salud. I heard that message on Salud. And so that meant to me that we were really penetrating in the community to get our message across. And we have to do research, and so we had what we call a control community and our intervention communities, and we were able to, through this particular program, reduce the number of women that had not come in for screening, so that more women were being compliant with their screening efforts as compared to the control group that did not receive our program. So from this, we thought, okay, that was kind of a regional program. What can we do to build a national network? And we know that networks are becoming very, very important, and that networks connect you to others who are doing something similar so that we can have a bigger effect. And this particular slide here in the background is actually a Twitter network. And so you can see that the large nodes are individuals kind of sending out the information and looking at all the little blue lines and looking at how many people they can connect. So our first project, national project, was again funded in the early 90s. And when I was finished my doctoral program, I said, where are the Latinos? Why there is no data on, it was always white, black, other. And if there was some data on Latinos, it was maybe on Mexican Americans, and we didn't have the other groups represented. So I put together the first large research grant called the National Hispanic Leadership Initiative on Cancer to say, we need to be at the table, we need to be looking at other groups. So I identified colleagues from throughout the U.S., in New York, working with Dr. Jose Marti, looking at Puerto Rican communities, in Miami, working with Ed Trapito, looking at the Cuban community, in San Francisco, working with Eliseo Perez Estable, looking at Central and South Americans, and Greg Talavera looking at urban and rural Mexican Americans in San Diego, and then San Antonio, we were the coordinating center. So you can see we've all aged, but we've all grown in our careers, and we're moving on. We brought in other groups. We brought in the Chicago area, and then from their own communities, we went into identifying regional areas that they could each work on so that we could continue to go the research network. And this network has just been growing and growing over the last 20 years. And as I mentioned earlier, we've done work in the area of screening. We're doing a lot of work in the area of patient navigation and showing how it works and what are the specific elements that work in our Latino community. And now we're moving into looking at improving quality of life among our breast, prostate, and colon cancer survivors. And this network continues to grow. We now have hubs within our regions that are doing their additional outreach work, and we've got over 2,000 individuals that are following us through our networks on the web, and we stay in touch with them. The Redes en Acción model had three major components. It had research, training, and education. In research, we were always advancing what's going on in our different communities, and we worked together as a team to look at the similarities and differences among our Latino populations. And then training, we have mentored over 200 Latino students from bachelor's all the way up to early career faculty, and then the education, just constantly being out in our community and providing the information, both English and Spanish, to and creating an awareness about the need for cancer. So then we want to know, is our network really working? What kind of research do we need to do? So we worked with a gentleman, Nosh Contractor, to help us analyze the effectiveness of our network. We wanted to look at its functionality. We wanted to look at what impact the network was having, and did it help really enable our individuals that were working with us. And more than 60% of our participants indicated that Redes was making a difference in increasing their knowledge and professional relationships. In other words, they felt empowered about the opportunity to exchange their information with like-minded individuals, and it also boosts their self-esteem and collective efficacy to increase their impact on their work. It was amazing when we bring groups together like this, that Latino says, you know, it's so nice to see other professional Latinos like myself in this room. Normally I'll go and there's just very few of us represented, and they really felt empowered by seeing so many like themselves. So Redes en Acción is a powerful engine for research and knowledge, and it cultivated science and was an example of interdisciplinary collaboration. So now moving to how we're applying this knowledge that we had in cancer to childhood obesity. And what we're finding is that childhood obesity, as you well know and have heard in the media, is becoming a major issue. A physician told me, she says, you know, I have a 4-year-old who's overweight by 100 pounds and already has fatty liver. Fatty liver, over time, turns into liver cancer. You know, these are things that we are seeing, diseases in our young population that were not there in our generation. So we've got to stop this trend. And who are we seeing the highest obesity rates in? Is our Latino children. Over 39% of our children are overweight or obese, and a large number of them are already, having additional health problems. You'll always see the circle around their neck, which means they're pre-diabetic, and there's just so many other things that are going on. So through the support of the Robert Wood Johnson Foundation, we created Salud America, and this is to create a Latino research network focusing on reducing Latino childhood obesity and finding solutions for this issue. So the first thing we did is we invited both researchers, academics, nonprofits, advocates, policymakers, and parents, teachers to join our network, and we started exchanging information with them. And we've started a very active blog and social media campaign. And in there is that we wanted to send them monthly alerts and quarterly e-newsletters that are filled with role model stories, the latest news and research, and funding opportunities, and things that individuals can get involved in to create action to reduce childhood obesity. And the first thing we did was we created this video called Did You Know? This video was narrated by a Latino boy, and it shared with the community all the facts and figures that were impacting our community with regards to Latino childhood obesity. People began downloading this information and taking it to their PTA meetings and creating advocacy work around it, and that's exactly what we wanted to do. And to date, we have received over 50,000 downloads of this particular YouTube. And at the same time, we created Salud Today. And this has just been a movement and an umbrella for a lot of the work that we're doing that embraces not only our cancer work, but also our childhood obesity work and other work that we're doing in other chronic diseases. But we wanted to make sure we were on target. We didn't want to just come up with something that we felt, this is what we should do for the community. So we used our online network to say, tell us what you want to know and what we should focus on in order to reduce childhood obesity. And so we allowed them to become, part of this input that we got from this large network, and we did what we call a Delphi survey. We did 3 rounds for them to prioritize the issues. And the 3 most important things that they identified for us were family, communities, and school. They said, this is what we really need to focus on. So again, through the support of the Robert Wood Johnson Foundation, we were able to give out pilot grants and in those particular areas of family, school, and community. And so we had Latino and non-Latino researchers from across the U.S. apply for this opportunity, and we were able to fund 20 grantees. Their faces are throughout the areas. We were able to fund projects in 13 states that focused on doing work in Latino communities. And these particular projects were funded on a small basis. It was only $75,000 for a 2-year period of time. Some examples of the projects that we were able to fund was one of them, for example, with Dr. Zan Gao. He started in Lubbock and then moved on to Utah. But he developed a program that helped provide after-school programs on a structured basis. And he used already a computer-based program called Dance Dance Revolution, but then he added more dance and more physical activities to that particular program. And after the kids completed the program and he compared it to those who had not, his kids, predominantly Latino kids, participated had better improved 1-mile runs, and they also improved their math scores over time. And so he's now taken this program and is now applying it to schools in Utah with high Latino populations. Another one of our researchers, Dr. Dharma Cortez from the University of Massachusetts at Boston, she was very interested in the nutrition side of things, and so she followed a group of Latino families and says, let's see where you're spending some of your resources when you go to the grocery store. Well, she found that our Latino families were spending about 1/3 of their income on foods that were high in fat and high in sugar and didn't have a lot of nutritional, good nutritional quality. So she developed an educational program that helped families look at what they were purchasing. She would take their grocery receipts and she would then educate them on the different things that were lower, that were not as good for their family, and how they could be substituted with more foods that were better for them. And she did this in a bilingual manner so that she could make sure she reached all the families. And now she's working on a new project, going out for funding to maybe take a grocery cart and paint them, green, yellow, and red, and the red obviously gets smaller, so that when we're thinking, we're being a little bit more conscious of what we're putting into the grocery store basket and trying to put in more of the positive type foods there. So these are just some types of examples of the different types of projects that our researchers were able to do. And then another thing that was really important for us was something that we call the policy contribution. So most of our work is based at the community level, and many of our researchers don't think about themselves as being policy change agents in the community, but they can. So we worked with Dr. Larry Green and Judith Hodison to develop something that's called the policy contribution spectra. And so it's not just about passing legislation at a national level or a state level, but we can be change agents on city council, different levels of our community. And so we wanted to educate our researchers to say, don't only do research, but how is your research going to be lasting and make a difference in your community? So we developed something that's called the policy spectra. I hope y'all can see that. But it's kind of a stage of change. Where we looked at pre-policy, policy development, policy enactment, and then post-policy. And what we wanted to do here is that sometimes we might just be, our programs were designed to increase awareness and change. Other times they were a little bit further along in this spectra, and we wanted them to be able to know where their project fit and how it could make a difference. So they could raise awareness, they could reframe the issue, they could discuss and communicate it with policymakers to helpfully create change. And the work can go on at multiple levels at the same time, and some of those who contributed to the policy by raising awareness on the problem, while others are educating and mobilizing the group. And others are saying, well, a policy passed, for example, we're supposed to have physical activity in our schools, but who actually is implementing it, and are they providing it? And another of our researchers found that they weren't, that our Latino-based schools, or schools with large number of Latinos, were less likely to be implementing some of these policy changes. And another, so we had Dr. Otteson work with us, and she interviewed each of our 20 grantees and showed them where they were on this policy spectrum. And so, for example, one of our grantees on the border and working with the colonias was Dr. Nelda Mier, and she started at the learning stage. She showed the community what were barriers. Why were people in our community not exercising? Well, we didn't have sidewalks. There were loose dogs. It was very hot. There were all of these things. There was no safe places where the kids could go play. So all of these things were as the data that she was able to gather, and she was presenting it at a community forum. And there just so happened to be an architect person who was into designing a new low-income communities, and he was able to take that information, and now those particular new housing projects are more likely to have some trails added to them, basketball courts, and other recreational elements, so that families in this affordable housing would have more opportunity to exercise. In another project, we had Dr. Dudley, and this was down in Brunswick, New Jersey. And he empowered high school girls, Latina girls, from his community to use something that we call photo voice. This is, you take your little cameras, you know, those disposable cameras that you buy, you give them to the students and take pictures of what's going on in their community that they would like to see change. So these young ladies showed dumpsters that were right in the middle of the street, you know, with dogs that were loose, and they showed a swimming pool without water, and so forth. And they went to City Council. They got time on City Council to say, we want changes in our community. And they advocated for three things. They wanted their city pools reopened. They wanted PE credit recovery program in their schools, and they wanted the grounds of the schools to be opened after hours so that they could come and exercise and use the tracks of the schools. And so all of these things were presented to their city councils, and they're still moving forward and in working with them. But you can imagine these young ladies now are empowered to know that they can make a difference. So our policy contribution spectra here is very important. It can be used by evaluators who want to set up common measures. Are we moving things? Where are we on this spectrum? It can be used by strategy seekers if we want to identify where you can make an impact, or it can be used by pathfinders, how you can determine if you can make a contribution, and where are you, and how can you go on to the next step. Or it can be used for communications to get someone to understand what you're trying to do with your project and help it move forward. So as we've just finished our first phase of Salud America, we were able to do a number of things that with our pilot projects that we were able to award totaling $1.5 million. Those researchers have gone on to acquire new research, and now $30 million is being applied to reducing Latino childhood obesity. I talked to you about our video. It continues to be one of the most effective YouTubes that's being downloaded. We talked about the policy spectrum. Now we've empowered our researchers to know that they can also be policy change agents. And all of our work was recently published in the American Journal of Preventive Medicine, and we have a supplement there in case anybody would like to go and review some of those particular projects. And next, where are we headed? Well, the foundation really liked the work that we're doing. They gave us a 2-year extension, and they're talking about another 2 years in working with us. And we are really focusing on accelerating the diffusion of health policies through peer modeling and networking to motivate and empower change in Latino communities. We now have the numbers. We now need to make a difference. So with the new Salud America, we are translating evidence. We're finding out what kind of research is there. We're taking what our researchers learned plus others' research. We're developing stories to really highlight the importance of this information, and we're building tools for capacity so that people can go to one location and download information that they need to make a change in their community. The foundation told us there were 6 major areas that if we could focus on these 6 areas that we could make a difference on childhood obesity. And I'm going to go through each one of these in just a moment. The first one was sugary drinks. what we have found is that our Latino kids consume an above average amount of sugary drinks. They're drinking Coca-Colas, they're drinking Gatorade, all of these things that we used to think a lot of fruit juices, they all have a lot of sugar. All our kids need to be drinking is really water. We need to increase their consumption of water. So we're trying to really look at ways to provide our communities with information about how to reduce sugary drink consumption. Another is, how do we get better foods in our neighborhoods? We have a lot of corner grocery stores. Some of our smaller grocery stores don't provide a lot of fresh fruits and vegetables. So again, our research showed that in our communities, the Latino communities had less access to good grocery stores, so they could have access to fresh fruits and vegetables, and reduce and getting our corner stores to offer more of these types of foods as well. When we looked at foods in schools, we again found that in our Latino-based schools, or schools with large Latino students, were more likely to be exposed to high-fat, high-sugar snacks and sugary drinks in their schools, compared to non-Hispanic white schools. With regards to marketing, it was really our children are being exposed to a lot of advertising, promotion of high-sugary drinks and foods as well through the media. And an interesting study done by the Red Center, they were saying, our Latinos families don't take offense to this. They think, well, but that message now is, is targeting me. It's something for my kids. I see kids like me on that ad, but it's the wrong types of foods that are being promoted. So we're trying to get healthier food promotions. We want to make the right choice the easy choice. Why do we have to work so hard to make the right choice the easy choice? Another thing that parents were telling us is we need more active places for our kids. Our kids have fewer options in terms of physical activity outside of the school. And our parents tell us they're very concerned about safety issues. Sometimes these playgrounds, have needles in them and all of these kinds of things or they're not kept up, and so their parents don't want to let their kids go to these parks. And then also just having more active places. We need better parks and playgrounds for our kids to be able to have access. So those are the 6 critical issues that Salud America is targeting in terms of encouraging policy change. So how are we going about this, and what is it that we need to create change? Well, our network was telling us they want to know where they could get information on policy initiatives. They want to find out, what innovations are going on in different parts of the United States that are working for other Latino communities. How could they get resources to help educate themselves about what they can do in their community and how they can connect with other individuals. So these are the critical sources that we are now focusing on and making sure we provide our community with this information. In our community now, it's really hard for me because I like to be touching and interacting with our individuals, and now it's become this kind of virtual network, but this is the new wave of how we're empowering more and larger communities. So how could we do that? How are we bringing all of this information together? So what we did is we've done our research in the 6 areas. We've turned these into what we call research briefs, that if you need a document to provide to a policymaker, you can download it and here are the facts, and here's what's going on, and you can add then your local information. We've also developed, and I'll show you a little later, infographics, as well as we're telling positive stories through the web now. This is very time-consuming work. We've hired curators who are constantly searching the network and pulling this information together. And we've increased our activities into the social media, and again, using peer modeling to share some of the skills for success. And we've brought all of this content into now what we're calling Salud America, Growing Healthy Change. So this is where the evidence, the curation, and the social media are now coming together on our new website. And again, our purpose here is to develop community capacity to create healthy policy changes via education, peer modeling, to empower people to become community change agents. And we're accomplishing this through 3 major steps. And we have to be very, very careful that we're not crossing the line in terms of lobbying. We're an academic, state-based institution, so all our materials have to be passed through legal to make sure that we're not crossing the line. But basically, we are finding concrete policy initiatives that are in their own areas, and I'll show you in just a minute how this works. We are capturing this information on a national basis. We're finding resources to start or continue their own advocacy, and we're coming back and we're asking you, once you've downloaded this information, we want to hear from you what's working in your community. So the first step, for example, if you were interested in learning about sugary drinks in the Oregon, Portland area, you would go to Sugary Drinks, and then you would put in your location, and you could then create maps of schools, cities, county, or at the state level, depending on the area you wanted to focus on, and find out what was going on in your topic. And if there was nothing populated in that, because we're trying to put in as many states as we can with the information that we've gathered, you can then find a state that's similar to yours and to see what they're doing. For example, here's some things that are going on in policy changes in other communities already. For example, in South LA, a Latino owner of a business is now providing more fresh fruits, vegetables in his market to make them more accessible to their community. In Nevada, they've started a Walk to School campaign. And again, also in California, as we all know, they're always on the forefront of a lot of good stuff. They're putting warning labels now on their sugary drinks so that parents are more aware about the calorie content and the impact that it can have on their children. So here's what you would find in each of the 6 topic areas. You would have the evidence that's available in English and Spanish. You would have videos that would support the information. You would have an infographic that you could take back and share, for example, at PTA meetings. And all of this information can be downloaded and shared at PTA meetings, council meetings, or board meetings to really excite and motivate your community to create a different change. So let me show you an example of one of our infographics. Let's see, I'm in a little trouble. Was asleep. Okay, thank you.
Latino youth drink more sugary beverages than their white peers.
These drinks represent almost half of their daily sugar intake and may increase the risk for obesity. Studies show that by age 2, 74% of Latino kids have consumed sugary beverages.
And one study found that 43% of Hispanic high school students drink between 1 and 3 sugary beverages a day.
Research shows that a sizable tax on sugar-sweetened beverages could decrease consumption and reduce the prevalence of obesity among Latinos.
And a penny per ounce tax on sugary drinks may contribute to an up to 24% reduction in sugary drink consumption. Research also projects that such a tax may reduce body weight, new cases of diabetes, and the chance of heart disease.
We need your help educating your community on how pricing strategies and recommendations for healthier beverages may prevent obesity among Latino kids.
Go to www.salud-america.org to find out more.
As you all know, YouTube is getting really popular, and so we're just trying to put in more information that can be easily downloaded and attractive and short snippets that can be used. So if you go to our website, you'll find the latest scientific reports, dealing with sugary drinks. You'll find templates and other resources that you can use, and you can look at webinars and tweet chats as well, and just different ways to get involved. And we have different things available on different types of projects. Am I doing okay with time? Oh, okay, good. Okay. And then the next thing is that, as I was mentioning earlier, is that we are now creating something called Salud Heroes. We want to learn what our communities are doing on their own. You know, our communities are very innovative, and we really want to capture those particular stories. So we have a team going out to different states and capturing different information. But and we want to use this again to help create that change both at the policy and system level. And so this one actually just happened in San Antonio, but there were two really cute little girls named Alyssa and Michaela Esparza, and they came up with a program called Fitness Fanatics. Let's see, for some reason I don't have the magic touch here. Okay, there it goes. Great, thank you.
Physical activity is a vital part of preventing childhood obesity, but Latino neighborhoods tend to lack after-school and community fitness programs that offer the chance for active play. In San Antonio, Texas, 2 young Latina girls started their own active play program to help other kids and parents get together to play.
We were watching The Biggest Loser, and we're like, hey, if those teenagers can do it, we can too. So we started talking about if we could get some kids in the neighborhood, do some exercising.
The girls wrote a letter asking for community support and created a Craigslist ad reading, "Kids Needed for a Healthy and Active Kid Program Started by a Kid." The ad generated donations of fitness instruction and educational resources from the community, and of course, got the word to kids to play in their program called Fitness Fanatics.
We decided to make it 90 days to get to know the kids a lot, and also it takes you 45 days to usually get used to something. We asked them just to eat healthy, cut off all the junk food, and at least drink 4 glasses of water each day.
By the end of 90 days, not only were there 30 kids stretching, running, and kickballing, but the girls were getting national attention.
We got to meet Jillian Michaels, and she was short, and she was funny and cool.
Shorter than on TV.
But I was so that I couldn't even speak. I was speechless.
Yeah, we wanted to look mature, so we were all of our excitement.
I love these fanatics because we got to meet new people that we are now good friends with, and we lost a lot of weight even though we weren't even trying to lose weight.
We just tried to have fun while being healthy.
I'm a fitness fanatic! I'm a fitness fanatic! I'm a fitness fanatic!
These girls were just amazing, but you know what? There was a grandma behind this as well, and so she was taking care of the girls, and she says, you all need to be doing something, and so then when the girls created this, grandma got really active and helped them do a lot of connections and stuff. But it was just an amazing story. It was local, and it has grown viral now, and other groups are starting Fitness Fanatics as well. So we want to hear about other stories. We want to highlight, Portland. Let us know what's going on here in the Oregon area that we can highlight. So just go onto our website, share your stories. We'll have people follow up with you and share that. And just in closing, I wanted to share with you some of the things that we've had challenges with. As I mentioned before, there's a lot of legal implications. We've got to be careful that we're not crossing the line in terms of lobbying, that we're really focusing on educating our communities and providing them with the information. But we also have to be careful of the requests that come in, because it could be someone asking us to do information from it, and we may not recognize that it's from a legislator, and we cannot organize any information. their folks can come and they can access all our information, but we can't help compile it for them. So we had to go through all kinds of legal reviews. It takes a lot of time and effort on our staff to pull this information together. And then we're looking at evaluation in terms of what are we doing now? What are some of the metrics for social media? We don't have a lot of access to that kind of information. And so this, our program is part research, so we really have to move and advance the social media. But we feel here what we're doing is that you can use theory-driven, all of this is theory-driven, but we can capitalize on new media to make a difference. And we're applying it not only to our current work in childhood obesity, but other work as well. And I just want to thank you very much for your attention, really encourage you to look us up so that you can learn more about what you can get involved in and share your story with us. So thank you very much.
Thank you, Dr. Ramirez.
Thank you
for sharing the work. So at this point, we have about 15 minutes for Q&A. So myself and Alan will go around the room with the microphones, and now's the time to ask Dr. Ramirez any questions. Now, you all know you have more questions than that. Oh, I don't see that.
This is a very impressive program. I'm so glad that you came to Portland to share it with us. Have you had any interest in community gardening? As we've done our research here in this area, it seems like it should be really promoted, and I was wondering if it ever came up.
Yes, actually, we do have a video on community garden and how there was, a little area. And we started first our stories in San Antonio, but how it would develop and how it was promoted. And then one of our pilot researchers also did the community gardening and showed how you could increase the consumption of fresh vegetables in a family by having a community garden.
Hi, Dr. Ramirez.
Hi.
My question is on the videos, the sharing our story. I know of a lot of things going on in Los Angeles, as you already know, and I want to submit something, but I'm wondering, if you guys actually feature all of the stories that come in, or do you need more stories, or do you already have a lot?
Well, we need more stories. We've just spent about a week out in California, so we've got more stories that are going to be coming out as we speak. But they do have to kind of fit on this policy spectrum, because we try to make sure that we have a variety of stories and what issue, and then if it's one of the 6 issues that we have to focus on.
Oh, okay, I see. So I could just go ahead, anybody can submit stories, and then you see if they fit into those.
Exactly, and then one of our curators will call back and interview, for additional tips and information.
So I think what we need to do is just submit it out there, and then hopefully.
Yeah, we want to show that there's something going on in every state that people can access,
Okay,
and be models for others. Yeah, thank you.
Good morning, Dr. Ramirez.
Good morning.
Knowing that 50% of Americans live in food insecurity, I was wondering how we can connect all the resources that you have with the food insecurity with the families, and how we can work it out on that.
Well, that's a very good question, and we're really trying to work with kind of local grocery stores or our corner stores that they can, these food deserts, to introduce them to, and there's more and more programs. There are Trust in America, there's different types of groups that are coming together to provide incentives sometimes for the corner grocery stores to help them put in the refrigeration that they need, to begin making those changes. So it's a small step, but that we want, for them to be offering more fruits and vegetables versus the chips and the soda that they have in the front of their counters. Gradually making some of those changes are really important. Thank you.
Hi, my name is Cassandra of Upstream Public Health. We're a policy advocacy organization here in Portland. And my question is a follow-up about what you can post and promote on your site. Are you looking for education programs only, or can you put the sensitive policy advocacy issues, like if we're fighting for something, we're taking an advocacy stand, can you share that information?
We have to be what they call 3 clicks away from promoting any particular policy issue, unless it's an issue to inform. If it's designed in an educational methodology, but we can't say go vote. So that's the difference. We can't tell people to vote, but we can educate them on the issue. So there are certain things going on, and they're a group mobilized around that issue, then we can share that. But we just can't say go vote. And again, it has to fit with one of the 6 issues that we're working on.
I was wondering, at the beginning of your talk, you brought up the topic of self-efficacy. And my question is whether or not you feel that self-efficacy has the same role with kids in the role of obesity, or whether you feel like it's more of an empowerment issue or community empowerment issue that leads to change.
It's all of those things. I mean, you won't change if you don't feel you can do it. So you got to be empowered within yourself. You got to have that self-efficacy. Say, I want to change. But you also need our environment has just become a supersized environment, a fast food environment. All of these things that are challenges for our families. So, for example, soccer moms will tell us, well, I have to buy something on the way home because, they don't get out of practice till 7. By the time we get home and try to fix a meal, it's crazy. But we're saying, well, but maybe you can pack them some food that's healthy to carry in the car, have those healthy snacks and so forth, so that they can gradually make those steps to make those positive changes. But as you well know, there's a lot in the media that's influencing our kids, and we need to put more positive things on the media so that they can, reflect on that as well.
Amelie, thank you again for being with us. I wondered if you could please share a little bit about the successes of your famous mayor and what's been done with the Mayor's Fitness Council. Many of you may know that San Antonio is proud to have a mayor who's been nominated to be our next Secretary of Housing and Urban Development, Mayor Julian Castro. So if you could share, because we want to have this happen here in Oregon and in the Northwest.
Yeah, no, it's a great question. San Antonio is known to be one of the fattest cities in the nation, so it's not a designation that we want. And so it really took some of the work that CDC had been doing in terms of putting prevention into practice. And San Antonio, at that time under Dr. Fernando Guerra, was a recipient of this kind of 5-year transformational grant, but the mayor got behind it. There was also a small grant opportunity for communities to develop mayor's fitness councils. And so he has pulled community leaders from throughout San Antonio to mobilize. And it's amazing how much volunteer time is going into these efforts. We have big businesses making sure that they are looking at not only big businesses. We have USAA, that's a major banking and insurance business that if you work for them, it was great. They've got all your exercise facilities. They make sure that they have all the good foods available to you and so forth. And still, people aren't changing to lose weight, but they're also adapting those kinds of things for a small business owner. What can a small business owner do to make change happen? But we're not as bike friendly as Portland is, but we're moving in that direction. And we're trying to have more farmers markets and those kinds of things. But it did take this community action. We meet about 3 times a month to find out where things are going and what are we pushing. We have what we call our stamp of approval of the Mayor's Fitness Council for different types of events that are going on in San Antonio, so that everybody can kind of go behind it and are looking for that endorsement. So we're really excited. We're sad to see him go to HUD, but we know he needs to go to other higher places, and we just hope that the momentum will continue. He's built some beautiful connections of some of our walking trails in San Antonio so that people can walk further and connect our missions, and just doing a lot of neat things that the community needed restructuring for. So we're really excited about that. So thank you for asking.
Time for just one final question here.
My question is more specific. With the Salud, you mentioned that people need to hear the message 3 times, Is that a number that we can use with other health initiatives?
I would think so. This is just a communication strategy that, before people actually remember it, if they can kind of be exposed to the message at least 3 times. Some of the marketing industry also use some of those standards, so that's where that number came from.
Thank you again, Dr. Ramirez.
Thank you. It's really a pleasure, and I want to applaud you all for the wonderful work that you're doing. So,